Hi guys, Heather here. So I know a lot of you have thought to yourself, what area of nursing should I go into? Do I want to go into ER, ICU, OR, cardiac, ortho? I mean, there's so many, like how do I choose? And you probably really won't know until you go through your nursing school clinicals and you find out what area best fits you and what areas you're kind of scared of. Like for me, when I was in nursing school going through my postpartum rotation, I was like, this postpartum thing's kind of cool. It's really chill and relaxed, and the patients aren't really sick. They're just having babies. But then I remembered that I'm kind of afraid of babies, and teaching mothers to breastfeed wasn't really up my alley. So I kind of scratched that from my list. And then one day I was sitting in lecture, and we were going over the heart and cardiac, and I just totally fell in love with it, and I was like, oh my god, I want to be a cardiac nurse. But I actually didn't even start off in cardiology because I heard through the grapevine that med-surg is better for new grads because you have a big variety of patients with different diagnoses and you can practice more of your skills, instead of being like confined to one area. You don't have that broad spectrum of learning. But I was just really coerced by my nursing instructors because that's the idea that they would plant into our student minds. And I was like, okay, med-surg it is. So I ended up working on a med-surg rehab unit. But I loved it. I really did work with a wide variety of patients. So in that respect, the grapevine and my instructors were correct. I worked with pneumonia patients, kidney dialysis patients, cancer and post-liver kidney transplant patients that weren't acutely ill, septic patients, ortho patients, abdominal patients with G-tubes and NG tubes, and you name it, they were on our unit. And I don't really remember cardiac patients because they're more of an acute situation. But I did float to a cardiac unit one time, and let me tell you the differences between the cardiac unit and my med-surg unit. I had almost a revelation working on that cardiac unit because I don't think I was allowed to take care of cardiac patients because I wasn't really trained to take care of them, so I probably had med-surg patients on telly. So working on a med-surg unit can be physically demanding. I mean, they're in rehab, so you gotta help these patients to the bathroom, out of bed, in the chair, to the moon, everywhere. If they need to get up and do something, you're going with them. And lifting these patients all day is like being at the gym and lifting weights all day. So yeah, it's gonna get kind of tiring. So when I floated to the cardiac unit, I saw my lady get up to the bathroom by herself, and I was like, holy cow, this is amazing. My lady doesn't even need help going to the bathroom. I have been working on the wrong unit all this time? Just kidding. My unit was still one of the best units I've ever worked on. But at that moment, along with many other reasons, I fell in love with cardiac even more. But I still praise the med-surg unit that I worked on because I did learn a lot. On a lot of med-surg units, no, not med-surg, rehab units, they don't really do a lot of IV therapy, like blood products, IV antibiotics, IV stuff they don't really do. But on our unit they did, so I learned pretty much all of that except chemo because you have to be chemo certified and I wasn't. And we didn't do chemo on our floor because it was not an acute floor. And the pace of my unit was very manageable. It wasn't chaotic and crazy like a cardiac unit where you can have 3 discharges and 3 admits in one shift. Whoa. So as a student and going through your clinicals, and even as a new nurse, you'll have a revelation such as I did and find out what unit best suits you. Heck, there's so many units, you could work in them all. Who says you have to work in one? You could be like a multi-unit working nurse. I don't know if they have a name for that or not. But anyways, thanks everyone for watching. Talk to you soon, okay? Bye.